A family is speaking out after they say a Toronto hospital is violating their father's rights. The family tells us Toronto Grace Health Centre is refusing to let him use his tablet for more than an hour a day. Because of COVID-19, no visitors are allowed inside, and it is his only way of communicating with the outside world. But the hospital says anything more would be considered a breach of privacy.
Hi, Daddy. How are you doing? I hope you're feeling okay today.
Adalia Schweitzer's 69-year-old father has a rare disease called multiple systems atrophy. Tommy Jutkovich has the ability to listen, think, and feel, but he can't walk, eat, talk, or move his body. Notably, he cannot use his hands and therefore has no way to control his own tablet.
Unfortunately, now for 23 hours a day, he has nothing to listen to or do.
For 4 months, he was a patient at North York General Hospital, and after the pandemic restricted hospitals from allowing visitors, Adalia's mother was able to remotely control her father's tablet, putting on his favorite programs and organizing video chats throughout the day.
All we want to do is communicate with my father. When he sees his children and his grandchildren, I mean, it brings such a smile to his face, it would melt your heart.
To make room for COVID-19 patients, he was transferred to Toronto Grace Health Centre last week, where he is permitted to use his tablet, but for just 1 hour a day with staff controlling it. The hospital says allowing someone to remotely control the device would breach privacy policies.
One of the concerns, of course, is that in this case, the tablet or iPad would be and is controlled remotely. Whatever information is shared is just broadcast across the internet. In terms of expectation of privacy, the law within healthcare in Ontario, we don't see that as acceptable.
But the family says exceptions should be made during these unprecedented times to find a compromise, such as turning off the tablet when staff enters the room.
It's really been a lifeline for him because, you can imagine being alone in a hospital without any, communication to your family, access to the outside world. This is his lifeline. This is how he, is not only communicating with us, but, he's being kept mentally stimulated throughout the day.
The reality for us is there have been several accommodations already made with respect to the individual that you're referencing. And we have, and our team continues to work with the family in response to this.
His family says he was a much beloved teacher, hockey coach, and principal for 42 years in Toronto and deserves better than this. A spokesperson for Ontario's Minister of Health says hospitals are considered autonomous corporations, so they can't comment specifically on this case, but they do add that hospitals and staff are expected to act reasonably to support patients during this unprecedented time. For City News, I'm Yazdani.